Happy New Year and welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. This is episode number 55 and the first of 2019. So this is our final year in review episode, the top 10 episode. I know it's the one you've all been waiting for. If you missed the first three, you might want to check those out. There's the Innovators episode, there's the Clinicians episode, and then there's the CIOs episode. You can check those out on iTunes. You can check them out on the thisweekinhealthit.com website. You can check them out on Google Play as well. This podcast is brought to you by Health Lyrics. Be a market leader. We help you to clarify your health IT plan, eliminate confusion, align your work, experience breakthroughs. Visit healthlyrics.com to schedule your free consultation. My name is Bill Russell, recovering healthcare CIO, writer, and advisor with the previously mentioned Health Lyrics. Well, here we are. The last episode of this series, which is the top 10 episode. And, this is a fun and a dangerous episode. It's fun because I get to go back and listen to all the great content and just remember the great conversations that we had this year and just soak it in one more time. It's dangerous because there can only be 10, right? So we've had between 35 and 40 guests this year. We've done over 2,000 minutes of recording, and you're going to hear 21 minutes of that. So I went through and just listened to it and just pulled out my favorite episodes. And so that's a little dangerous because some people might feel slighted. I'm guessing that no one is sitting around their podcast listening device right now and going to be hurt that I did not select their 2 or 3 minute video to be on here. But on the off chance that I did, I just want to make sure that all of my guests recognize that I really appreciate everybody coming on the show. It really has been an honor to have them on the show, and we've had a great time recording this year. For those of you who have been on the show, you know this, but for our listeners, for a lot of these people, I just send them emails and say, will you lend your voice to this community which is about helping to train the next generation of health IT leaders. And so many of them just jumped at the chance, and I'm thrilled to be able to bring this show every week, and I'm thrilled that you're listening to it. The numbers just keep going up every week since we've started. So while there is a little bit of risk of selecting the top 10, I don't think anyone's going to be offended. So we're just gonna get to it. So coming in at number 10 is Jason Joseph, CIO for Spectrum Health. Jason was gracious enough to sit down with us following his panel discussion at the Becker's Conference in Chicago this past fall. And I was really impressed with his perspective. He's a newly minted CIO, and I asked him the question of what opportunities exist for health IT, and this was his answer. Check it out. So what's the biggest opportunities for health IT right now? You're talking to a whole bunch of CIOs potentially. What's the biggest opportunity that you see out there?
Yeah, I think you could answer that question in two fronts. One, I think that we have a huge opportunity to leverage some of our core infrastructure and simplify it so that we are more digital ready. I'm a big believer in having a few core systems that you really invest heavily in, but the pace of change is such in our business that you're still going to need to adapt, and you're going to need to flex into those strategic opportunities. And it's incredibly hard to do that if you've got complexity under the hood. And so I would say do not underestimate how much that complexity will hurt you in the long run if you're not ruthless in rooting it out. Simplify. Not only for the cost, but also for the agility that it's going to provide you. And so that's kind of philosophically, I would say, our opportunity is to get more simple so that we can be more agile, so that we can innovate. And I think the innovation is going to come in two main areas. You've already touched on them: digital, and how we transform our healthcare systems digitally, some of which will be very common types of capabilities that we're all going to have in our toolbox. And then there's going to be those things that are truly differentiating. And the second is how well we use the data that we actually have in our systems to come up with new answers and new outcomes. And that's where our business and our clinical competitive advantage is going to come in with advanced analytics and some of these tools. If we can apply those well, we will actually see significant changes in the core of business of healthcare. There's other things that we do every day that just helps us kind of make the core a little better. The things that I look for are the things that actually change the core. The things that say you no longer need that diagnostic process. I'm looking forward to a point in time, and this may be way out there, where you could actually go in and have some medical imaging done, and when you walk out, you're going to get a report because it's so protocolized and the AI engine has become so strong that you're going to get a 99.6% accurate report out. Same thing with low acuity primary care. So the engines, the intelligence, the machine learning is going to quickly make it so that these are realities in the near future, and we have to be ready to capitalize.
You got to love that answer. Root out complexity, use the data to really change the core business of healthcare. I love how pragmatic his answer is, but I also love the visionary aspect of it. So at number 9, we have a two-time guest of the show, Sarah Richardson, who is the CIO for the California and Nevada markets for Healthcare Partners, a DaVita Medical Group. Sarah is an amazing leader and a great voice for women in leadership within healthcare. I was able to catch up with Sarah at the Chime Fall Forum down in San Diego, and this is what she had to say about soft skills.
The pace of change has been so dramatic in IT itself. How do you prepare your IT staff? But one of the things we've been talking about is the role within health IT's. The roles are really changing from technology roles to people roles. People and understanding culture and communication. And these are all areas where if we have as they were talking about, a 75-25 or 80-20 male to female ratio, this is areas where we can really make that transition and start adding a lot of, because STEM is underrepresented today, the females, but that's not what we're hiring anymore.
No.
We're hiring, so what does it look like? I mean, what are we looking to do with that staff to help them make those transitions?
What I feel like people forget about, or what they say, is that people are focusing on the soft skills. It's the soft skills that women are better. It's the soft skills that are important. These aren't soft skills. This stuff is hard.
Oh.
When you need to have a thoughtful conversation, you need to be articulate. You need to know what you're talking about. You need to have the education. You need to have the background. Those are not soft skills. So leadership and communication and the ability to affect and drive change within an organization, to be a role model and beacon for others, to have a crucial conversation but do so with respect, those are tough skills. Those are the things that everybody needs to bring to the table. And so whether you're in STEM or operations or wherever you come from an educational perspective, it's having the ability to embed those capabilities into your organization, into your teammates, and create an environment where they can practice those types of skills. And it's not always going to be at the bar at 10 o'clock at night. I'm always fascinated when I come to conferences. Everyone's, at the bar and people excited to go out and party. I'm like, you are never going to see me having too many drinks or staying out past 10 o'clock, because that's not where you're going to create that momentum and create an example for others to follow.
Yeah, absolutely. I guess what you're saying is we should start calling it hard skills. And soft skills should be the things where we just sit behind a computer and create spreadsheets and do all that
When you
stuff.
do not have to interact with other people, that is a soft skill.
Yeah.
You just have to love that answer and the wisdom that Sarah brings to the show. When you have to interact with people, those are the hard skills. When you have to actually lead people, to rally them, to get them excited, and to point them in a direction and get them motivated to do things, those are the hard skills. Sitting behind the computer, not interacting with people, those are soft skills. I really appreciate Sarah's insights and her willingness to take time out to come on the show. Thank you very much, Sarah. And I look forward to coming on your SoCal Hymns podcast early this spring. And also look forward to seeing your new Apple Watch. At number 8, we have Daniel Barchi, CIO for New York Presbyterian. In my research for the show, I was struck by the number of times that Daniel referred to history. He referred to history in his talks, in his interviews, and I thought that was interesting. So I thought I'd just ask him why that was. So give this a listen. I read a bunch of stuff on the internet in preparation, and you appear to be a big fan of history. You made reference to Lincoln, Grant, the Wright brothers, Alexander Fleming, and you even studied the history of the Chrysler Building, as you know, that you referred to in a story, which I found interesting. First of all, where does that come from? That just the love of history, and I think the second thing is what lessons are you drawing on right now in terms of inspiration for being a CIO in healthcare in 2018?
I'm interested in history because I look at what we do at New York Presbyterian as a small part of a continuation of work that men and women have done for more than 200 years now. And in any great institution like this, we are standing on the shoulders of giants who went before us. And so the foundations that they put into place are important to recognize. And whether you look at your local history in your town or village, or you look at a national or global history, we can look back to fantastic people who are inspirational in what they did and learn a lot of lessons from them. So I think when I look at history, I try to see what challenges people faced and what lessons I might draw from them. Now, thinking about going forward, I think that we want to invest our time and our energy and our resources in a way that create a foundation. More and more, as we've run into a problem, I've thought not, oh, what do we need to do this week, but if we could really change things, how would we want this to look 5 years from now? How would we want it to look at 20 years from now? And if that's where we want to end up 5 or 20 years from now, what changes do we need to put in place right now that will get us on that right glide slope to get there? Even if it's hard, it's worth doing, but there's no point in putting in a quick fix and then 2 years going in and do the hard work later.
Wow, what great wisdom from a great leader. And think of some of the things. I mean, we're standing on the shoulders of the giants that went before us. We lead today with an eye on the future. We are setting the foundation for what is to come. I love the wisdom of Daniel's answer. Appreciate those who have come before you and create things with an eye on those who will come after you. So throughout the year, people come up to me and they say, hey, there's someone you should meet, or there's someone you should have on your show. And I really appreciate those conversations. And this next guest is someone who I didn't know starting this year. And Sue Shade, one of our other guests on the show, introduced me to Aimee Manneker. And Aimee is a former CMIO for a children's hospital and now with Starbridge Advisors. And Aimee and I started talking about the Arch Collaborative. She introduced me to what the Arch Collaborative does around EHR effectiveness. And it was a really fascinating conversation. So here's Aimee at number 7 sharing some of those insights.
So I think one of the hottest topics, both for me personally and across the industry, and I suspect, is how do we address the EMR, whatever brand you're on's role in provider efficiency and satisfaction? So, people say physicians are burned out. I was at a social event the other night and the neurosurgeon next to me kind of heard what I did and immediately started complaining about clicks to me. No joke. Doesn't even work at anywhere where I've worked, but I hear about the clicks. And so I think we're beginning to address that. And one of the most helpful tools, so I did a project on that at my last organization, but his class is doing this Arch Collaborative. And I think we're getting some really good, fascinating data. And so what class is doing is they're asking, I think they're probably close to 120 organizations, and they basically say, hey, to all the users, do you agree? How do you feel about it? Does your EHR enable you to deliver high quality care? And then kind of like when we do population health, you look for the bright spots. So what are the characteristics of places where everyone says, yeah, it's pretty good here, the EMR? So it's not what you think. So you ready for the big surprises?
Sure, love it. So you're going to share some of the things that Arch Collaborative found?
Yep, with their initial findings, and that I've also had personal similar experience, but I think it's more powerful to talk about this national data. Absolutely. So they found, I'm going to give the big surprises first, that IT spend doesn't correlate. Voice recognition doesn't correlate. And scribes doesn't correlate with improved user satisfaction.
That's wild. That's hard to believe, actually, because you hear that a lot. If I didn't have to do the data entry, this whole thing would be fine. That's an interesting finding.
So, and in fact, this week, JAMA had an article about scribes and satisfaction in 18 PCP practices, which shows the opposite. So then now that I've kind of reined up, everyone's assumptions, what are successful organizations? And what they found, and I personally found, is it's really about how do you help support the users to use the EMR? And it's robust, high quality, or at least the perception of really good training at first. It's ongoing support and the ability to personalize, which I tie to ongoing support. And one of the things that I really think, and it hasn't been borne out yet they haven't gotten as granular, it's ongoing ownership and engagement of the physicians. They need to have some ownership and engagement, not each and every one, but like someone in each specialty needs to own the content and understand the software. And that's what really makes a difference. So I just, one of the things is the organizations that haven't had good data keep trying to, it looks like they throw money and technology at it. While the organizations with high user satisfaction seem to have more of a culture of support and a relationship with IT. And the other thing is that everyone complains about entering the data, and this is my concern about the JAM articles. No one talks about getting the data out, which is as important as entering the data.
I think Aimee captures the spirit of so many of our guests on the show, that we know we can do better and we want to do better for our clinicians and for our patients. And we continue to work diligently to find ways to ease the burden and really to move technology into the background. So it's not at the forefront, but really is in the background, just serving the needs of the people who need it most, and really restoring that human interaction back into healthcare. So Ken Lawonn is CIO for Sharp Healthcare in San Diego. Ken and I became friends when he moved here. Ken Lawonn is the CIO for Sharp Healthcare in San Diego. Ken and I became friends when he moved to Southern California to replace longtime CIO for Sharp, Bill Spooner, who was also on the show this fall during the Chime series that we did. So Ken and I decided to discuss an article that talked about these disruptive forces that are impacting healthcare. And they identified 8 disruptive forces, and Ken and I decided to go in depth on those. So coming in at number 6, here's a short soundbite from Ken Lawonn, CIO for Sharp Healthcare. The 3 more are millennials as consumers, Internet of Things, and non-traditional entrants into the market, such as Amazon, Berkshire, JPM.
We talked about that last one a bit, but
yeah. So what would you tell your peers about those last 3 things, consumers, IoT, and non-traditional entrants?
Well, I'd say, consumers kind of goes along with what we talked about on the retail side. They talked really about the millennials and they don't want to go through the traditional process. So I think you have to start thinking about, how do I serve a different kind of population? It's really about transforming what we've grown up as kind of an operational automation of points of care and removing the complexity internally. And we've shifted the complexity to our customers. And we really have to switch that model around and think about how do we take the complexity out of the interactions that we have with patients and consumers. And if we have to move a little complexity back inside, then how do we work on, on automating and streamlining that? But you really have to shift your thinking as an organization from what I'd call a process and operational driven company to a consumer or retail type company. And as part of that, the Internet of Things is all this information that can be collected and the patients are looking at on their own is what's the plan for incorporating that? How are you working with Apple or whoever to bring that data in to make it relevant to providers? So I think it causes us, for me, it's really shifting, and everything has to be thought of as more of a patient consumer focused thinking, not about how can I make this part of my operation more efficient, but how can I make that interaction? Because as you said, you don't want to lose the relationship.
Yeah, so the consumerization of healthcare came up an awful lot this year. It seems to be a trend that is not going away, and you have all these disruptive forces and companies coming in from the outside to try to impact healthcare. I think Ken really captured it well when he said, shift your thinking from a process and automation company to a consumer-based company. Our next guest is so gracious. I've mispronounced her name so many times, I half expect her family to start picketing right back here behind me. Ann Wyler is the CEO and co-founder of WellPepper. She is so smart and so excited about what technology can do within healthcare and to change healthcare and the healthcare experience. In this clip, we discuss the move from point solutions to the platform. At number 5, here's Ann Wyler. What area would you focus on? Right now you're on patient engagement, patient enablement. What is there another area that you're looking at going, that's a great area?
Well, what's really interesting is just in the time that we've been doing this, which on the one hand seems like a long time, and in healthcare is really not a long time at all. We've gone from point solutions to platform solutions. So a point solution for each type of patient or each type of intervention, whether that's like, here's a cardiac rehab solution, here's a total joint solution, to like what we do and what we've always done, which is we can support any type of patient experience. So interestingly, we went from people saying to us, you're trying to do too much, and now they're telling us we're trying to do too little because of this, the ones who see this overall digital patient experience. So they're asking us, how do I attract more patients? How do I, you do a great job of retaining them and recalling them, but how do I find them to begin with? How do I do some basic triage of them when they're just starting to think that they might need care? And so I think what we would do if we were doing today is we'd actually do something even bigger, because our customers are asking us for that something bigger, and the market is ready. I think if I'd come out with like, we're doing all of these things that a patient needs to do outside the clinic, we're going to do them. If I'd done that like 4 years ago, people were just like, you're crazy. I don't understand what this is. So I think we would do a similar thing, but even bigger.
Yeah, platforms really have changed every other industry. Our EHRs really haven't taken that next step. They haven't filled that void. And I think that's partially, not for lack of trying, I think it's partially because it's really hard to get from here to there on top of 1980s technology. But who knows? Maybe we'll see some re-architecting of these platforms, or of these solutions to become platforms, and let's see what 2019 brings. Yeah, who owns the medical record is a pretty simple question that you would think would have a very simple answer, but sometimes we get wrapped around the axle with this one. Dr. Rod Hochman is the CEO for Providence St. Joseph Health, one of the, believe the third largest health system in the country. And he is one of the leaders that I appreciate that has the courage to state the answer to that question very simply. At number 4, we have Rod Hochman answering the question of who owns the medical record. I apologize in advance. The audio was a little rough on this video. I wanted to cover one last topic, and that's data with you. And there's a handful of ways I want to talk about this. You've talked about the power of data in healthcare and how it can have a meaningful impact on outcomes and many other things. We really have a ton of data within healthcare already. So let's talk about ownership of that data, scope of that data, and privacy. So let's start with the first question, which is, who do you think owns the medical record, or who should own the medical record, and how will that change the way we view data and use data moving forward?
So I think ultimately individuals need to be in control of their own data. I think that's almost a given. The question is, who do they give proxy to and who do they trust? And unfortunately, we've had some bad examples out in the social media venue. I think in healthcare, we've always considered the sanctity of data, and we're regulated to do that. So we protect that incredibly well. So what I hope is that I want individuals to have control over their data, but I hope they will trust their health organization to be that trusted partner with them to then figure out how that data gets used and where it gets used. And I would not be as afraid to say, just trust me, to some of the other organizations out there that are now trying to accumulate data on folks. I just think that one of the advantages that we have in the sector where we are is that I think our patients and our families still trust us, and we have a relationship with them. So that's the way I would see that working. And then the question is how do we use that data for our patients' benefit, but also kind of advance how we do care, and in a way that as you know, we're a 501c3, we're not a publicly traded company. Our interest is the health of our patients and communities. But we see ourselves being able to use that data to advance that, not necessarily within a shareholder value.
There you have it. Simple answer. Data is there to serve the patient, not necessarily to build shareholder value. Really appreciate Rod Hochman coming on the show. And here we are, now down to our top three. Most weeks we discuss the news, but some weeks there are topics that I really want to know more about, and artificial intelligence is one of those topics. And I decided to do a deep dive episode where I would find an expert and just really talk about artificial intelligence in depth. Dr. Anthony Chang is Chief Intelligence and Innovation Officer for CHOC, Children's Hospital of Orange County, as well as the Sharon Disney Lund Medical Institute. He leads the AI Med Conference around the world, the most recent one in December down here in Laguna Beach. And we had a fascinating conversation around artificial intelligence in medicine. Here's a short story that he shared with me about human-machine interaction.
So that's a great story about the AlphaGo software program from Google being the human contestant in Go so handily, actually. And everyone publicized the second game 30's first move because it seemed like the computer made a move that it had not learned from any human based on hundreds of thousands or millions of games before. It was like a move out of nowhere. But yet that move was instrumental in winning the second game. What's not publicized is in the fourth game, one of the moves the human champion made was sort of in the category of that really creative move. So some eerie moments there, right? Because maybe the computer thought or was creative for the first time, and now the human champion is learning from the computer. But I think it's a wonderful example how man and machine can learn from each other.
Right. I love Dr. Chang's vision for the future where machines and intelligence working in the background, providing that information to the care providers and even to the patients. He made the point in our interview that, we really don't think twice about taking directions from computers anymore. It's really becoming more and more commonplace. You don't think twice about following your GPS when it tells you to make a right turn, and you don't really think twice about the information that comes back from Alexa when you ask Alexa or Siri a question and you get that information back. We do check it, we do filter it, but we are doing it every day. And I'm also just thrilled that Dr. Chang agreed to come on the show, and I really appreciate his time. As you guys know, we share a lot of videos on social media platforms, and this video got far and away the most attention of any of the videos that we shared this year. Dr. John Halamka is the CIO for Beth Israel Deaconess Medical Center in Boston, Massachusetts, and John and I got into a discussion on the role of the CIO, and I think John really captured this massive change that's going on in the role of the CIO. And, only John can really address it because, he is a practicing physician. He's an MIT trained engineer, and he's been a CIO for a very long time. So take a listen to John Halamka talking about the role of the CIO.
That the role of the CIO has changed totally, right? So back again, since you and I are of similar age, we were software developers and architects, and we could tell you what RAM to use based on its transactional speed. Do you think any of that matters anymore? The answer is no. What you need as a CIO in 2018 to be is a convener. You understand business requirements and strategy, and then you take that and procure services from multiple cloud providers and plumb it together. And so it's just so funny. I have an MIT engineering degree. You know, I had to be a doctor, engineer, politician, economist to survive the 1990s. But today, unbelievably, you'd probably best be a sociologist.
Right.
It's all about people.
Yeah, the role has changed to how can you help the organization to navigate change? And that is helping people to understand the vision for, hey, here's what's possible, and then bringing them together to have a conversation of, okay, if these are all the things that are possible, what should we be doing? Should we be doing something different in the Boston market than they are doing in Southern California? Probably. I mean, our environments are very different and our communities are different, and there are things that are probably a priority here than aren't there, but we're people that lead those conversations. It's really fascinating to me. The other thing that's fascinating is I had a fair number of conversations at the Chime Forum, and a whole bunch of the CIOs that have been pushed into this operational role, and then you've seen these other roles sort of elevate: chief digital officer, chief innovation officer, and I'm not sure the CIO, the chief information officer, knows what to do now, other than, okay, well, my job now is to keep the EMR running, to make sure the data center runs, to have DR capabilities, and even security somewhat. I mean, not the implementation, but the oversight of security has been taken away from them as well. And they're saying, okay, my job, they really have become more of a director of infrastructure and technology than a traditional CIO. I mean, what do you say to someone who's saying, I want to get out of that trap? How do I get out of that trap? And how do I don't know, differentiate myself in that space?
Right. So I became a CIO in 1996. And as a CIO, I was the chief digital officer, chief innovation officer, chief medical information officer, and the CISO. Right. And so what have I done over the last 22 years? I'm the air traffic controller.
Right.
But I have carved up the office of the CIO into 5 different components. I mean, the ones we just enumerated, because that's the nature of how the work has to be done these days. So fine, tell a CIO, you're a sociologist, it's a change management activity, and you're a convener, and you have these experts working for you at these individual domains. You can't do it all yourself. It takes a village.
I love having John on the show. Agree with John, disagree with John. That's not really the point. The point is John puts ideas out there that we have to think about, ideas that we have to discuss, agree with, disagree with, really come to grips with. And I think that's what I really like about him. The other thing is he really has a passion for training the next generation of health IT leaders, and that's what this show is about. So thank you, John, for coming on the show. So here we are, down to the #1 video from This Week in Health IT for 2018. Todd Johnson is the CEO of HealthLoop and someone that I've gotten to know pretty well over the last 7-8 years. I really enjoyed our conversation this year. He gave us, a couple of great sound bites, actually. One of the ones I didn't use was "Your technology has no soul." It's a great story of Todd presenting to a Silicon Valley investor, and it was some funding round. He was showing him his technology, and the gentleman looked at him and said, "You know what, Todd? The problem with your technology is it has no soul." And it was a transformative event for him. It caused him to change how he thought about developing the technology around the user experience, and he now talks very significantly about building empathy into the applications that he's putting out there into the marketplace. You'll want to look that one up because that's not the #1 video, even though I'm excited about it. The minute I heard this clip, I asked him a question, and the minute I heard this clip, I thought, that is one of the top things I've heard in a long time. It just resonated very deeply within me, and I believe it'll resonate with you as well. So without further ado, here's the #1 soundbite from this year, Todd Johnson, CEO of HealthLoop. All right, so this is a selfish question. Let's talk about implementation from a digital entrepreneur standpoint. What are the characteristics or activities that organizations that have successful implementations What do they have in common?
Yeah, I mean, it's conviction, right? Systems have conviction around a thesis and really work to identify the right partner and treat them like a partner, and make real investments to achieve those outcomes, right? Find ways to really go strong. I think it's almost that simple. And clearly, when there's the right economic incentives and organizational objectives that we can align those incentives together, it works. We've seen, and you've seen this, the emergence of the pilot, right? There's so many damn pilots, and now we have innovation centers that just, they're pilot wood chipper factories. And on the one hand, it's great that, health systems get to take a test run for digital innovations, and digital innovators get some test runs with hospitals. But more often than not, it results in failure. And it results in failure because it gives everybody an opt-out, right? A chance to take the exit ramp, as opposed to just saying, look, we're committed to this one way or the other. We will make this succeed. This is where we're going, and we're going to go big. And I think that's really the critical, like when a health system has conviction and is committed to achieving real outcomes and is willing to expend the energy to get the change management inside, the sky's the limit, right? You can do amazing things. Without that conviction, you can sputter.
Yeah, and I think the conviction, I think that's a great answer, by the way. I think the conviction starts with, what problems are we trying to solve? I think too many health systems are trying to solve 100 problems, and you can't solve 100 or more problems every year. You almost have to say, these are the 15 to 20 problems we are going to solve this year, and we're going to focus our energy, our resources, our investments on these 15 to 20 problems. It depends on the size of the organization, but I just find that the focus of the organization is spread so wide. So there's a sort of a conviction that these 20 problems are the most relevant to our community that we serve right now. I feel like it's a little bit of the Jerry Maguire at the end. You had me at conviction. And if all he had said was conviction, this would be a great clip. But then he gave us this visual picture of the pilot wood chipper. And I just think that's so indicative of what's going on. We just keep trying things instead of really sitting down and figuring out, what are we trying to build? What are we trying to establish? Are we trying to do experience for the clinicians? Are we trying to do experience for the patients? And really setting the direction for our partners, for our system, for our staff. And I just think it's a phenomenal answer. It resonates with me, and I hope it does with you as well. Well, that's a wrap for 2018. I want to thank all of our guests this year. I want to thank you for your time and your commitment to developing the next generation of health IT leaders. Your voice has had an impact this year, and it will for many generations. And that's what I believe, and I really appreciate you being a part of the show. If you enjoyed the show, please share it with a friend or colleague. If not, please drop us a line. Let us know what we can do better. Bill at thisweekinhealthit.com. As I said earlier, we recorded over 2,000 minutes of audio and video this year. This episode just covers 21 minutes of that. If you're interested in more of this great content, you can find it at thisweekinhealthit.com. You can also hit the YouTube channel. Easiest way to get there is thisweekinhealthit.com/video, and that will pop you over to our YouTube channel with over 400 some odd videos. Our sponsor also host the content on that website, healthlyrics.com. So that's all for 2018. Please come back every Friday starting in 2019 for more news, information, and commentary from industry influencers. That's all for now.